Hi, and welcome to another presentation from the RFDS STAR program. Today, we're going to present a short video on the utility of ocular ultrasound in flight. But before we do that, it's worthwhile just reminding ourselves of the potential indications for the use of ocular ultrasound. These include ocular trauma, visual disturbance, suspected foreign body, ocular pain, and head injury. In this particular session, we're going to focus very specifically on the evaluation of intracranial pressure. There has been for some time very good evidence to show that ultrasound can be utilized to provide a reasonably good correlation between the optic nerve sheath diameter and intracranial pressure. The obvious advantage here is that this is a rapid test that can be conducted in a non-invasive manner and at the patient bedside. So, it's important to note that you need a high-resolution linear array transducer of greater than 7.5 MHz and ideally greater than 10, and you utilize a closed eye approach, which means that the transducer is actually placed on the closed eyelid and not on the globe itself. You certainly need a generous application of ultrasound gel, and you will find that it is easier to measure the values that you need to obtain if the depth is adjusted so that the eye fills the whole screen. Note also that with ocular ultrasound you often need relatively high gain, so be prepared to play with and adjust the gain as required. Now, some people suggest that you can do this with just scanning in the transverse plane, but others would suggest that perhaps both the sagittal and transverse planes should be scanned, measurements obtained, and then averaged. Okay, to obtain an estimate of intracranial pressure, you need to obtain a value for the optic nerve sheath diameter. This should be measured at a point 3 mm posterior to the globe every time. You should measure twice in both eyes and obtain an average. If the average optic nerve sheath diameter is greater than 5 mm, this is indicative of elevated intracranial pressure. Dr. Minh LeCong, Senior Medical Officer with the Royal Flying Doctor Service up in Cairns, will now illustrate the use of this modality in the aeromedical retrieval setting.
Hi there, it's Minh here. Just demonstrating the use of ultrasound during a retrieval. It's, what night is it? Thursday night. I'm with Fiona, she's at the camera, and I'm going to show you how we use the ultrasound on a flight. In this case is someone who's had a seizure. The clinic doctors had given him some midazolam and it kind of stopped seizures, but he had a very low conscious level and wasn't protecting his airway and he wasn't breathing all that well, so we decided to intubate him and we're taking him back to Cairns ED. We don't know if he's got raised intracranial pressure. What we're going to do is demonstrate how we do an optical ultrasound using the ultrasound to look at the back of his retina and to measure his optic nerve sheath, and that will give us an idea of his intracranial pressure. Okay, so I'm just firing up my computer at the moment. So this is a USB powered device. It plugs into your laptop, into your USB port, and it's a 7.5 MHz ultrasound probe. You can see here that he's on the Ocular 3000. We're monitoring his end tidal. He's got a good end tidal CO2. He's on a propofol infusion, so he's nicely anesthetized. This is actually an obstetric probe, but I've got it at its lowest depth, which is 10 centimeters, which is still a little bit too much, but this is the back of the retina. So we look for the optic nerve, which is, let's move the probe around. So this is the back of the retina here, scanning backwards and forwards across his eye. Really looking at the back of this retina, trying to find the optic nerve. It's there. black line.
Okay, I'm just going to take you away from Minh and the aircraft for a second because I think this illustration makes it a little bit easier to see what he's trying to point out to you. As Minh states, the optic nerve sheath is seen as a black line behind the posterior globe. Now the measurement that you're going to take in terms of the optic nerve sheath diameter needs to be taken at a point 3 millimeters behind the posterior globe. And the reason for this is that ultrasound contrast is at its greatest at that point, and that guarantees that you're going to get more reliable results. Now back to Minh in the aircraft.
So that's the back of the eyeball. This kind of black part here is this optic nerve. I'm going to do a couple of measurements now. So we've frozen the image. Now we're going to measure it. Yeah, so it's 3 millimeters. Now we measure across it. So from this point here, side of the black line. So it's 5.6 millimeters, you got that? So I'm going to actually save that one. So I'll do ICP measure 17th. June 2011. Save that. So what it means, if your intracranial pressure is over 20 centimeters, it equates to an optic nerve sheath diameter of 5 millimeters. So the fact that this is over 5 millimeters, 5.6, means the intracranial pressure is over 20. So that's abnormal. So we don't know exactly how much, but we just certainly know it's over 20. So that's that. Thank you.
So in summary, bedside ocular ultrasound is easy to perform even in the aeromedical setting, and there is a good correlation between an optic nerve sheath diameter of greater than 5 millimeters and elevated intracranial pressure. Finally, thank you for taking the time to join us in this STAR program session on ocular ultrasound. If you want some further information regarding the STAR program, please check the web link on the slide shown. Also, come back often to this YouTube channel because we'll be updating our programs on a regular basis. Thank you once again.